Hi, I'm Levi Geer. I'm here to tell you about epiglottis. Epiglottis is a lid for your throat that prevents food or liquid from entering into the windpipe. So the possible causes of epiglottis, so an infection could be caused in the epiglottis from trauma, say from a car wreck, or it could be from a thermal burn, if you were in a fire or somehow you got burned on your throat, or maybe you swallowed some really hot soup or really hot coffee. Another reason could be a bacterial infection in your throat. And moving on. So why is this relevant to us lay responders? Well, first, this is a medical emergency. If you can't breathe, if your epiglottis is so inflamed that you can't breathe, then automatically this is a 911 emergency. It's not something to even think more about. If there's a blockage in your throat and you can't breathe, then you have to call 911. And also having the knowledge of the signs and symptoms of epiglottis will increase the recovery in that individual's life. And it'll increase also life expectancy too. So hopefully they'll live versus die. It's definitely possible that your epiglottis could become so inflamed you can't breathe, and then it could lead to death. And I came up with a scenario here I'll read you real quick. David's friend, Jake, is having difficulty breathing and his voice sounds muffled. He's been complaining about it for the past few days. David looks in Jake's mouth and it appears inflamed. David calls 911. Jake was taken to the hospital and was put on an IV with antibiotics. The swelling went down and he recovered. The key takeaway to this is that David had a background and previous knowledge of epiglottis. If he didn't, then it's possible he could have mistaken this for just a sore throat. Complications. So, more complications here. If this were to spread, which it can, epiglottis, it can spread into your lungs, or it could spread into your brain. So the infection could make you have pneumonia, or it could develop into meningitis for your brain. And also, of course, respiratory failure would be the number one complication. Providing care, recognizing signs and symptoms, and also treatment. The first thing you want to do is call 911. And while you are with the individual who possibly has epiglottis, I would not offer them any food or any type of drink. I would have them sit up, at least sit up upright so they can breathe properly. Don't have them lay down or do anything of that nature. You want to have them in a natural position of breathing. And then keep them from going into shock. If you have a blanket, maybe possibly offer them one. And going into signs, so the signs of epiglottis would be a muffled throat, sore throat, and possibly drooling. And treatment. The first thing your doctor's going to do is make sure that you can breathe, that you have enough oxygen going into your lungs. And if you can't, then the first thing they'll do is they'll give you a mask, an oxygen mask. And if that doesn't work, then they will put a tube into your throat, through your mouth, or possibly through your nose. And lastly, if that fails to work as well, then they'll do an emergency procedure where they put a needle through your throat. It goes into your trachea, and it bypasses your larynx. So it has nothing to do with the larynx. So you'll go straight into your trachea so you can breathe. They'll put a tube there, and sometimes you'll have to have the tube there for days. Just a matter of when or how long it takes for the swelling to go down so you can breathe properly. And then the last thing that they would do after they have you stable in breathing, then they would put you on antibiotics with an IV. Special considerations. So in children, there's quite a difference between children and adults. When developing this with children, it could develop in a matter of hours, versus with adults, it could be over the course of a few days. So if you come in contact with somebody who's a child and they possibly have a epiglottis infection, make sure that you call 911 immediately if you think that they do have an infection. Also, you want to put yourself in their shoes. When you're speaking to them, maybe you want to come down to their level so you're not as intimidating as you might be. Because with this type of emergency, you want to think about how they are thinking. If they're not able to breathe to begin with, then it's already not a good day. So I think if you kneel or just come down to their level, it'll be a lot easier for them to listen to your instructions and help with that. Prevention. So there is a vaccination that we normally get as kids. That's the HIV vaccination. It does help prevent epiglottis and many other infections as well. And here's my works cited page and my questions as well. Thank you for listening. Have a good day.